Now, I want to turn to the next key question, which is what are some of the experiences of survivors and some of their fears and needs, as well as fears, needs, and experiences of their family members. And we did a survey study of survivors through the good graces of the Sudden Cardiac Arrest Association. And they have an annual meeting each year, and we meet survivors and ask them questions. And I want to share with you some of the reflections of survivors because I think it's very interesting and illustrates a number of points about survivorship. So first, to give you a sense of who these people are, most cardiac arrest survivors are people in their 50s and 60s, although certainly some are much younger and some are much older. For whatever reason, in this population, we had more men than women, although we do believe cardiac arrest tends to affect both men and women equally. When we asked this cohort of several hundred cardiac arrest survivors where they experienced cardiac arrest, the majority single category was in the home. The other category, although it looks larger, was a hodgepodge of a number of settings, including in stores, on airplanes and airports, in train stations, all sorts of things. We know that most cardiac arrests occur in the home, which is why we feel it's so important that spouses and family members know CPR. We asked these survivors were their spouses or family members present, and indeed, a fairly large minority were present at the time, although amazingly, in many cases they were not. That was largely cases of out-of-hospital cardiac arrest where someone was traveling or in the street or in a store, and then other people were involved in saving their life rather than family or spouse. We asked them who did rescue you, and in fact it was a very wide variety of people who were attributed to be involved in saving their life. And note that 18% of the time it was a bystander, so a member of the lay public who just happened to be nearby. And indeed there are many people out there who have had the heroic experience of saving someone's life from doing CPR and using a defibrillator. Now, when we asked survivors what did they fear after their arrest, what were they most worried about? It's actually very interesting. Many people were afraid of being alone. They wanted the comfort of someone there in case something bad were to happen. Many cardiac arrest survivors fear exercise or going back to normal activities like driving. They fear swimming. They fear running. So things that might stress their body are a problem for them. And this in some cases leads to real inhibition of normal activity that cardiac arrest survivors might want to partake in. Sometimes they say holding their loved ones or even sleeping because they're afraid they won't wake up. So fear and anxiety is understandable and a big problem for many survivors after cardiac arrest. Now, when we asked them about function and what actually they found to be a problem, there were a number of things that were attributed to their cardiac arrest event, and what seemed to be the most common was memory. Many cardiac arrest survivors find that they have subtle memory changes. They can't remember things as well. They need to write things down on Post-it notes. So very real, very functional problems. Coordination was another common one. Many cardiac arrest survivors felt that they had a hard time doing fine motor skills like typing or driving. That coordination and balance were slightly off. And we're only beginning to scratch the surface of these issues. Because most people didn't survive cardiac arrest in the past, these issues hadn't been studied. So we're only beginning to learn the variety of problems that survivors encounter that may need to be dealt with. Now I want to share with you actually some comments, some unvarnished quotes that we have from some of our cardiac arrest survivors. They have some very interesting experiences and shared with us some of their experiences in sort of verbal form. When we asked them to reflect back on their event, these are just selected interesting quotes. One survivor said that they should take every day, one day at a time, and appreciate life because I received a gift. And I think that's something, an important and true lesson we can all think about is appreciating life. But certainly for people who have died and are now restored to life, they often have a very enhanced appreciation of the meaning and fleeting nature of life. Here's another quote from a cardiac arrest survivor. The doctors could not fully empathize, so the Cardiac Arrest Association webpage was very helpful, especially to know there are others like me. And I think this is a common problem for mortal or near mortal events, that people feel very alone. And that's important for us to recognize that, and that's where I think these associations can be very important. Here's a third quote. Emotional support should be mandatory. Doctors are great with the medical questions, but not with the emotional aspects of ICD shock. What this person means is an internal defibrillator shock. They had an internal defibrillator that went off. I think the broader point here, though, is that often physicians are not well trained in dealing with some of the emotional and anxiety issues surrounding cardiac arrest. And one could argue they should be, but we often are worried more about actually performing resuscitation care. And so emotional support and having a multidisciplinary approach is important in the treatment of survivors of cardiac arrest. Now, when we asked survivors what was told to them that was helpful, one survivor commented that I was one of the 5% that survives, and I was very lucky. So this survivor felt that knowing that they hit the jackpot, as it were, was important. Other survivors don't like hearing that because it makes them feel more alone, and we'll get to that as well. One survivor commented, "Every day is a new day to enjoy with family and friends, and I do just that." And so we applaud that optimism and that sentiment. Another survivor pointed out it's okay to be scared. You need to talk about your fears. And I think this highlights the fact that we underappreciate the psychologic and psychiatric needs of cardiac arrest survivors. And again, we're only beginning to enter into research and studies around these important issues. Another survivor commented, "Emotional support from my wife during that difficult first year, even though it was probably more difficult for her." And that highlights the very interesting issue of spousal or relationship stress that can be brought on by severe illness or surviving a cardiac arrest event. And we'll get to some spouse reflections in a moment. When we asked cardiac arrest survivors what was not helpful or annoying to hear, this is the flip side of feeling lucky. Some survivors felt, as this one did, "You are lucky to be here" was not a helpful thing to hear. You are here to do something special for the world, and did you see the light? So one category of response that well-meaning people often give to cardiac arrest survivors is, God chose you to come back for a reason, or you're lucky to be here. And I'm not here to wade into religious or theological issues, but rather to point out that that's a weighty burden for many cardiac arrest victims to deal with. If you're told that you're brought back for a reason, many cardiac arrest survivors I've spoken to said, "Well, what's the reason? I don't know why I got brought back." Sometimes it doesn't even make sense. And so some patients feel lucky. On the flip side of that is some people find it a burden and a stress to know that they were one of the few lucky ones. This survivor makes a very important point that people do not know the difference between heart attack and arrest, and they found it was not helpful, that people misunderstood what they went through. And we talked about this in an earlier lecture, the fact that in the media and in public discourse, heart attack or myocardial infarction and cardiac arrest are often commingled or confused, and it's important to think of them as separate entities. Heart attack or myocardial infarction does not require CPR, and most people survive. Cardiac arrest absolutely requires CPR, and most people do not. So it's important to get the public health messaging correct. Another survivor made a somewhat humorous point that people felt that this is presumably loved ones looking at this defibrillator in their chest that's gross. I don't know quite what to make of that comment, but the point being there are medical issues that some people find difficult to deal with. And another comment a survivor found was not so helpful was that, so you must have been pretty unhealthy before, huh? The point here being that having a serious medical event sometimes is embarrassing because it highlights unhealthy behaviors or suggests that maybe it's the victim's fault. Cardiac arrest strikes people in all manner of health states. Sometimes people are quite healthy. So it is important to point out there's no fault in cardiac arrest. It's a severe medical event that can strike without warning in people who are relatively healthy as well. Now, when we asked survivors what was the hardest to deal with after the arrest, one survivor pointed out that post-traumatic stress syndrome was a very big problem. And again, we only barely understand post-traumatic stress syndrome in the context of cardiac arrest. This is a somewhat depressing comment. The hardest thing to deal with was my spouse. She never recognized that I went through something major and we're getting divorced next month. So again, highlighting that a cardiac arrest event can put very serious stress on relationships and family dynamics. Another person felt the hardest thing to deal with was three things: the huge bills, that I needed to handle stress, and I couldn't drive for a month. So a myriad of problems that can occur after a major medical event. And then finally, one person said total loss of memory and concentration and not driving for 6 months. So you can see a theme here that sometimes motor skills or other functional skills are a real problem following cardiac arrest. When we spoke to spouses and partners and felt what was the hardest for them, one partner or spouse said, constant worry that she will lose consciousness again at a time when it will endanger her life. So basically just fear that what happened once may happen again, being a big problem. Another person said, now that we have become very active in this mission, we realize that many more cardiac arrest patients could be saved. The general public just does not know enough about this major health issue. I'm very glad for that comment, and I find that survivors tend to be very energized about making sure that people know CPR and people understand how important cardiac arrest is as a public health challenge. This survivor commented that her cardiac arrest could be genetic. She is protected by an ICD or defibrillator, but we don't know whether my 3 daughters may have the same genetic mutation, if that's what it is. So there are some genetic conditions that predispose to cardiac arrest, and if someone has that, that's a very stressful situation for family members and children. Finally, one partner commented, having to listen to why did this happen to me and why did I survive? So just dealing with some of the stress and anxiety from the cardiac arrest survivor can be a burden. So lots of interesting food for thought there, and a topic I think of great importance as we look forward to having more and more survivors. Now, one final question I want to address briefly here is something that's very commonly discussed surrounding cardiac arrest, which is the idea of a near-death experience, or what do patients actually feel during the arrest? And I show you here a vague image of a bright white light in a tunnel, which is often what is described as what cardiac arrest victims see during the arrest. Now, how can you see anything during the arrest? Well, the idea here is that people who are resuscitated from cardiac arrest often feel like they experience something at the moment of death, at the moment of arrest. Now, this experience is described by many, but not all, cardiac arrest survivors, and it's often described as a bright white light that they might see, or seeing a tunnel or light in a tunnel. Some survivors actually state that they saw the room from the ceiling, that they felt they were floating in the room. Some patients commented that they feel joyful and warm, that they sort of felt like they were going to heaven. I mean, these are real comments made by cardiac arrest survivors. In addition, oops. Actually, I'm going to redo this. I'm going to do an edit point. I'm going to redo this slide because I didn't realize we were at the end of the slide. Sorry, guys. Now, I want to turn my attention to one final question that comes up all the time in cardiac arrest pertaining to what patients actually experience during their arrest event. And I show you here a picture of bright white light in a tunnel. This is a common perception when you speak to cardiac arrest survivors. Many of them comment on seeing something or feeling something at the moment of death when they had their cardiac arrest. This is called a near-death experience. It's often talked about in the media and in public discourse around cardiac arrest. Not all cardiac arrest survivors have these near-death experiences, but some do. And they characteristically say that at the moment they died, they saw a bright white light, or they saw a tunnel or a light in a tunnel. Some survivors comment that when they died, they actually felt like they were floating in the room and they saw everyone in the room performing resuscitation efforts. Some survivors said they had this overwhelming feeling of warmth and joy. So a very complex set of experiences or perceived experiences at the moment of death that are sometimes described. And depending on which study you look at, as many as a third to half of cardiac arrest survivors have some perceptual issue like this. And one of the questions is, what do we make of this? Well, certainly some people interpret these things theologically, and they interpret this as having meaning relating to their theistic beliefs. I'm not one to wade into that, but I do want to speak to a little bit of our scientific understandings of what this near-death experience might mean. There is certainly some published evidence that there's intensive brain activity immediately before death. And this has been studied in folks not receiving CPR, but in people who were on hospice and known to be dying, and they agreed to have their brains monitored, that at the moment of death there is actually a tremendous burst of activity. So it's possible that these near-death experiences relate to this burst of brain activity as the brain is actively dying. Now, it turns out there's also similarities of near-death experiences to experience of patients with other brain injuries. So sometimes people with severe strokes or brain bleeding or other forms of coma will also have near-death experiences. So to a certain extent, maybe these sensations, these imputed memories are actually just reflective of brain injury itself. That brain injury, for whatever reason, brings these things into consciousness. It also should be noted that many patients do not report near-death experiences after resuscitation. And as a matter of fact, on a somewhat humorous note, patients with a sense of humor after their recovery often ask me, why didn't I get a near-death experience? I feel I was gypped. They wanted that joyful feeling. They wanted the bright white lights. And we have a little a chuckle together over that. But the point being that not everyone reports this, and we don't know exactly what that means. So our scientific understandings of near-death experiences are poor, but there are some hints that this may relate to actual organic processes in the brain tissue. Now, one important other experience that is related to cardiac arrest and may explain why some people don't have near-death experiences, or perhaps why some do, is that memory becomes very dysfunctional around the time of cardiac arrest and resuscitation. So I show you here a diagram of a brain, and you see a structure called a hippocampus. Now, the hippocampus is a very evolutionarily old part of the brain, and it relates to short-term memory. I'm very much oversimplifying this. I apologize to any neurologists listening to my lecture, but the hippocampus is integral in our formation of short-term memories. In addition, the hippocampus is very sensitive to blood flow and is very commonly injured in cardiac arrest. And so as a practical matter, we often find that cardiac arrest victims lose their memory around the event. They lose the 24 hours before the arrest event. They lose the day or two after the event, even if they're not sedated. And so memory becomes very funny. Might this explain why some people don't have the near-death experiences? They don't remember them? Or might this explain why some people have them, in that there's a loss of memory and the brain is putting something in its place, much like we often imagine we see things when we are trying to make meaning out of a vision or an experience? So I think in conclusion, brain function is still a great mystery, and neuroscience is really one of the great horizons of biomedical research for the 21st century. And this is not unique to cardiac arrest. The wide set of brain diseases, stroke, degeneration, Alzheimer's, and other brain degeneration syndromes, and indeed just normal brain function, are huge mysteries with many things to be learned. And brain function in cardiac arrest is no exception to this. So I always, as a cardiac arrest researcher and as a cardiac arrest practitioner, I remain humble about not really knowing how brains function and how brains recover after cardiac arrest, because I've seen people who looked like they would be severely brain injured who completely wake up, and people who thought would survive who did not, and people who have a wide variety of deficits and recoveries. So I've learned to accept what we get and to know that we need a lot more investigative work in this area. Now, hopefully you've enjoyed this somewhat meandering exploration of some of the issues pertaining to survivorship from cardiac arrest. I wanted to take a few moments now and give a summary and wrap up of our entire 5-lecture series on resuscitation science. Hopefully you've enjoyed it. What have we discussed in these 5 lectures? Well, we've talked at great length about CPR and defibrillators. We've talked about what you can do as a citizen, for those of you who are members of the lay public listening to these lectures. It's very important to know that the lay public has an important role to play in knowing CPR and using defibrillators. We've also talked about what happens in the hospital and what healthcare providers do when they have cardiac arrest victims, and then also what they do after they get people back from cardiac arrest, vis-a-vis therapeutic hypothermia and other treatments after the restoration of pulses. Dr. Gasky and to a certain extent myself as well have also talked about future therapies and what are some of the things on the horizon, some of the exciting opportunities for improving survival in cardiac arrest. And then finally in this lecture, we've talked about survivorship and some of the definitions of life and death and some of the experiences that cardiac arrest survivors relate during and after their arrest events. And it is not the hopeless event it was 30 or 40 years ago, or even 10 years ago. There's a lot of reason for this optimism. There's improved methods of CPR, and we talked about hands-only CPR and dispatch-assisted CPR. We talked about automatic external defibrillators, or AEDs, that are making a big difference in improving survival. Hypothermia is a therapy that improves survival after initial resuscitation. And a combination of all of these things have shown that in some communities that do all these things right, survival rates can be quite high compared to many U.S. communities. So they serve as shining examples that we can all do better and more people can go home back to their families and loved ones. The other really important take-home message, I believe, is that everyone should learn how to use an AED and how to perform CPR. I really believe this, and whether or not this should be done in the context of employers or schools or programs at home, these remain important questions. But the point is there's a lot of resources out there to learn CPR and to learn how to use defibrillators, and we should all avail ourselves of them because you never know when you're going to come across a need for these therapies to treat someone in cardiac arrest. Finally, hopefully I've left you with the message that resuscitation science is a very exciting field and there are many questions that remain to be answered. And hopefully over the next decade or two we will make great strides and continue to improve survival from cardiac arrest. Well, with that message, I want to thank you and remind you that this was a series put on and supported by the Perelman School of Medicine at the University of Pennsylvania, where I am employed as a physician and teacher at the School of Medicine. And I welcome you to visit our websites and learn more about our work. And I most specifically represent an entity called the Center for Resuscitation Science in the Department of Emergency Medicine, a research group focused solely on resuscitation science, both in the animal laboratory and clinically. And I welcome you to learn more about our work as well. Hopefully this lecture series has whetted your appetite to learn more about cardiac arrest. If so, then I've done my job. And I thank you very much for your time and attention.